Good afternoon, everyone. I'm going to go ahead and start. Thank you for attending our webinar on managing challenging conversations in the medical arena. On behalf of the George Washington University, we would like to thank you very much for your attendance today. Presenting today is Jennifer Bires and Cheryl Hughes. Before I introduce them, I would like to invite my colleague Ruta to walk us through some logistics. Welcome, Ruta.
Hello, everyone. My name is Ruta Brashinskate. I'm a program associate at the GW Cancer Center. So let's begin with a few housekeeping items. All audio lines are muted. Therefore, please activate your chat feature by clicking on the three dots at the bottom right if you're not able to see them. You can use chat to send questions, information relevant to the presentation or our discussion. Thank you so much.
Thank you, Ruta. Presenting today, we have Jennifer from Inova Schar. She's the executive director. As an executive director, Jennifer works to ensure that patients, survivors, and their family members have access to psychological care at no cost to them to help individuals cope with cancer, its treatments, and survivorship in the best possible way. She specializes in working with young adults who have been diagnosed with cancer, communication around end-of-life concerns, sexual health, and she has over a decade of experience running groups of people impacted by cancer. She oversees the Inova Schar Cancer Institute Arts and Healing Program, ensuring patients have access to the arts as a modality of healing and part of their treatment process. Jennifer earned her master's degree from the Washington University in St. Louis. She earned her bachelor's degree at Clemson University. She was awarded the Oncology Social Worker of the Year in 2017 from the Association of Oncology Social Workers, and she currently serves as the chair for the Board of Oncology Social Work. With Jennifer, she will be accompanied by Cheryl Hughes, who is an oncology therapist at Inova Life with Cancer. Prior to joining Life with Cancer, Cheryl worked as a member of hospital-based oncology and palliative care systems. During that time, she took part in and/or led hundreds of family meetings. Based on this experience, she has been instrumental in communication, training for ICU nurses, medical students, physicians, and social workers. Cheryl earned her master's degree in social work from Catholic University's National Catholic School of Social Service and has completed postgraduate certifications in palliative and end-of-life care, as well as traumatic grief counseling. Reflecting a deep respect for complementary healing arts, she received mindfulness training at the Mind-Body Medicine program at Georgetown University Medical School and completed trainings in both mindful self-compassion and mindfulness-based stress reduction. We thank them so much for joining us today. We're looking forward to hearing amazing things, and without further ado, I would like to welcome them. Thank you.
Thank you so very much, Sylvia. I appreciate it. And yeah, I don't have any disclosures. Jen, do you?
No disclosures.
All righty, we're good to go. Today, these are the objectives that Jen and I have laid out for us. Our main hope is that everybody leaves here today knowing a little bit more than they did when they started.
So what makes conversations like what we're going to talk about today so hard? I think, oftentimes not only patients come in stressed, we as clinicians may be stressed out as well, just given the nature of the work that we do and how difficult these conversations can be. And what we're going to talk about a little bit today is how that stress impacts our body and our ability to give and receive information. And then additionally, we know that when patients are coming to us, oftentimes they're almost like learning a new language in the medical world, which complicates things even further. And so we're just going to talk about some tips and tricks of how we regulate ourselves, which may help us regulate our patients and the families during some of these difficult conversations. We're going to kick us off today with just a very short video to talk about the autonomic nervous system. This is kind of the part of us that gets activated when we are in stressful situations, may cause adrenaline to be released, and oftentimes happens so quickly you may not even notice that it's happening. So we will play the video now.
Within your nerve system is a branch called the autonomic nervous system. This is the component responsible for the regulation of subconscious bodily processes like breathing, reflexes, digestion, and organ function. The ANS can be divided into two branches: sympathetic, fight, fright, or flight, or parasympathetic, rest, digest, restore. We can experience instantaneous imbalance, or we can experience long-term compounding imbalances.
The sympathetic response ensures the survival of our species. If we're confronted with a life-threatening situation, our bodies will react by redirecting the blood and resources from the immune and digestive processes to our arms, legs, and brain so we can fight or flee. A shadow of this response is also triggered chronically by everyday things. Things like the daily commute, or money worries, or deadlines, or food choices, or the 100 emails you get a day, or the fact that there is just never enough time. All of these things are stresses, and they all add up to tip the balance of your ANS towards the draining sympathetic dominant state.
The parasympathetic response also ensures the survival of our species, for without it, we would not grow and regenerate or heal from taxing situations. When we are in a relaxed and safe place, our bodies have the ability to slip into a state that allows us to recover and restore. Prolonged parasympathetic dominance can find you staying too long in that slow and steady place, and that's when you may find yourself becoming lethargic, apathetic, or lacking a spring in your step.
Thanks very much. Yeah. So we just wanted to point out a couple of things in that very short little video about the autonomic nervous system. So on the next slide, the things that I think are important to remember is our autonomic nervous system is made up of two separate sections: the sympathetic nervous system that we think of as like the body and mind's gas pedal, and the parasympathetic nervous system that we think of as that brake pedal, right? And I remember it as parachute, slowing things down, parasympathetic nervous system. So we can't shut them off, and we really don't want to. As the speaker in the video said, this system has helped to keep us alive for millennia. So it's a part of what we are, who we are as a species. The other thing that's important to remember is that it's all subconscious, and that we can be triggered in milliseconds to seconds, right? Without even understanding or recognizing what's going on. So we just wanted to have those things in the back of your mind as we continue on with the presentation. So, and we're going to show you another short video that's going to focus on the sympathetic nervous system response. So, and as Jen said earlier, this is kind of what's going on when we're preparing to go into a meeting that we think might be challenging. And also important to remember, it's not only going on with us, it's going on with our patients and families.
Even though it's going on, you start to feel it. So smoke alarms are loud for a good reason. Your heart starts to race, your breathing picks up, you become sweaty all over your body. You are stressed. And I'm not talking about the my iPhone just died kind of stress. I'm talking about the I'm afraid I might die kind of stress. Even though it's often seen as a dirty word, stress, like pain, isn't all bad. It's actually very useful if you're, trying to get out of a burning building. Your sympathetic nervous system is the part of your nervous system that responds to stress, and it does its job exceedingly well by focusing on what your body needs to do right now. Like when you're facing a life or death ordeal, you don't need to be digesting that cashew cluster in your intestines or producing reproductive cells or deal with later when you're out of harm's way. So your sympathetic nervous system sweeps these suddenly trivial functions aside to blast all of your energy to your brain and heart and muscles to deal with the threat at hand. So this is where I tell you that you're lucky to have a sympathetic nervous system and that it keeps you alive and that you would probably die in X period of time if you didn't have one, all of which is true.
Great. So we wanted to show these videos because they're a little humorous, but these systems are impacting us every day. And we also wanted to tell, relate it to a patient story. So let's assume you're in a room with Mr. Jones and he's newly diagnosed with metastatic colon cancer. He has 2 small children at home and his partner is, upset by the diagnosis as well as he is. So imagine you're walking into this room and, what happens with your sympathetic nervous system in this moment is that your heart starts beating really fast. Maybe your palms are sweaty. And this is happening with the patient as well. So they're getting this information for the first time. Their body may be experiencing this way as well. And everything in their body is telling them, escape, escape, get out of this situation. Because, this was built to keep us safe when tigers were chasing us. And so can you imagine if a tiger was chasing you, having a really rational conversation about what type of treatment you should expect next, or how your body is going to respond to the symptoms and side effects. And so realizing that our patients are sometimes having this fight or flight response, and by sometimes I mean pretty much all the time, and realizing that we may be experiencing it too, just gives us a little window into what's happening, and perhaps will allow us, as we continue talking, to talk about some of the compassion that we may want to have for ourselves and the patient, but also some really good tips to manage this.
Thanks, Jen. So we just talked a little bit about the sympathetic nervous system, right? And we saw the little short video about the sympathetic nervous system being our fire alarm, our body's fire alarm. And we're going to switch over now to the parasympathetic nervous system response, that other part, the rest and digest part of our autonomic nervous system. We're starting off here with a slide of Dr. Herbert Benson, mostly because Dr. Benson's research really pioneered mind-body research in the United States back in the late 60s, 1970s. He's a cardiologist who was doing studies on behaviors that impacted heart rate, and his team ended up doing a study on monks who were meditating. And what he found is the basis for what he calls the relaxation response. So he actually coined the phrase, the relaxation response, and he wrote a book that's also called The Relaxation Response. So we want to be able to talk about how we can, in fact, activate the relaxation response. So if we could go to our next slide. It turns out that there are several ways that we can activate the parasympathetic nervous system or the relaxation response. We're going to talk today about a specific technique that Jen and I find helpful both working with patients and other clinicians, but there are lots of ways to activate the parasympathetic nervous system response. Things like meditation, yoga, qigong, tai chi, even things like knitting and prayer can activate the parasympathetic nervous system. If you listen to that list, you'll notice that often the breath is involved in these activities. Conscious control of your breath can, in fact, activate the parasympathetic nervous system. And I think it's important to remember that these two parts of the autonomic nervous system, they work together, but they do not work at the same time. So if we are activating the parasympathetic nervous system response, then we are actually shutting off the sympathetic nervous system response, or that fight or flight response. So learning techniques that can help us to step back from sympathetic nervous system response can be helpful in the medical settings. It can be helpful in life in general. So we're going to talk today about a specific technique that can help us to, again, activate the part of our brain that calms things down and activate the relaxation response. So we're going to take a couple of minutes from our presentation today, and I'm going to ask everybody to just follow along. To get started, I'm going to ask that everybody find a position where your feet are flat on the floor. and your head, your neck, and your spine are all aligned and comfortable just for you. And what we're going to do is a couple minutes of what we call belly breathing or diaphragmatic breathing. So I'm going to ask everybody to put your hand on your belly. You can put your thumb about where your belly button is and then just allow your hand to fall down over your belly. And for the first 30 seconds or so, I'm just going to ask that you notice how you're breathing. So notice if on the inhalation, your belly is pushing out against your hand, and on the exhalation, your belly is falling back to the spine. So that's what we're trying to induce here, is an inhalation where your belly expands, pushes out against your hand, and an exhalation where your belly falls back to the spine. So you can see that having your hand on your belly while you're doing this can be helpful, certainly at the beginning, to notice that you're doing this correctly. And then there's another reason, which I'll explain after we do the practice. But for right now, I'm going to ask everybody to continue breathing like this, and I'm just going to set my timer for 2 minutes. So again, as you breathe in, expanding your belly like a balloon, and as you breathe out, allowing your belly to fall back to the spine. Doing this at your own pace. So that was 2 minutes. I want everybody to just take a heartbeat here and notice what's happening in your body. Notice any shifts that might have happened from before we did that practice till afterwards. And if you'd like to put into the chat section here, Jen and I are going to share trying to monitor the chat section, but I'd love to know if you notice anything that feels different after doing that kind of a practice for 2 minutes. This practice is what I teach. I teach to my patients, I teach to students, and I call it I just call it 2 to 3 because we recommend 2 to 3 minutes of breathing like this 2 to 3 times a day. The reason for 2 to 3 minutes is that it's long enough to notice that there's shifts going on in your body and your mind, right? You're kicking your parasympathetic nervous system into gear. But it's also short enough that people don't feel overwhelmed by doing it. So it's easy, right? You wake up in the morning, you set your timer for 2 to 3 minutes and you breathe. You find a couple of minutes in the afternoon to do the same thing. And then in the evening time, as you're winding down or before bedtime, you take another 2 to 3 minutes. And we do have some people saying, you noticed your breathing has slowed down. You notice that your body's relaxing, your shoulders are loosening up. So, and that's in just 2 minutes of this type of belly breathing activity. So we recommend that people put this in practice so that you get a sense of what your body feels like in this relaxation response, right? Where your shoulders are relaxed, your heart's beating really normally, and you're feeling calm and centered. And this kind of breathing can help us every day, throughout the day, but specifically, as Jen was saying, when we know we're going to be going into a situation where we might need to engage with other patients or family members who might be stressed out, if we can come from a place of calm, then we're going to be better able to engage and build the trust that's necessary in these challenging conversations. So the practice piece can't be overemphasized enough. The second reason, as I said earlier, for having your hand on your belly when you do this practice is that as your hand is on your belly and your body is calming down, which it must do in this breathing activity, you're conditioning your body so that every time you put your hand on your belly, your body is going to downregulate. So it can be a really handy tool to condition your body to be relaxed anytime your hand is on your belly. Practicing is the key. And we're going to talk a little bit more about some of the other benefits of activating this part of our nervous system.
So why do we do this? I hope some of you heard on the first video that it's likely that many of us are spending too much time in our sympathetic nervous system, just being overworked, having emails come in, our cell phones always with us, things, happening really rapidly, puts us really in a chronic stress state, which isn't good for us. It can lead to different heart conditions, just an overall not feeling well. But when we're able to kick into that parasympathetic nervous system, some of those benefits of relaxation can be what are listed here. Just this idea of having a slower heart rate, digestion improving, getting more sleep at night. And I'm sure we all know that when we get better sleep, everything works better. Gives us more confidence to handle problems. Many of you put in the chat just how after 2 minutes, your body felt more relaxed. So this idea of chronic muscle pain and fatigue, kind of having less of that can really be a benefit of relaxation. And a lot of times people just say they can concentrate better. They're able to put words and sentences together. Their mood is better, and they can really show up in life in a different way, and kind of the way that we all hope to do that. And, there is this idea of filling up our own cup. And there are times when, our cups are empty, and it makes it very hard to give to other people. And relaxation really is a way to fill up your own cup. And probably when we started this presentation, some folks are thinking, why are we talking about me? I thought we were going to learn how to deal with them, the people that are difficult. But that's really hard to do if we don't take care of ourselves first. And so these are, this is one way to really take care of yourself, and something that you can access, wherever you are.
Jen's absolutely right. It's the continued practice and self-care that helps us, right, to be present to other people. But in the moment, so if we're going to take a couple of minutes before a challenging conversation to activate that parasympathetic nervous system, there's also a lot of benefits. As people are noting in the chat section, we can feel more clear and more centered. And that's because when the sympathetic nervous system is engaged, the part of our brain, the most recently developed part of our brain that allows us to think rationally, our prefrontal cortex, it goes offline. Because under threat, our body doesn't want us thinking, gee, should I get out of the way of the train now? Or should I wait a few minutes? Our body just wants us to get out of the way of the train, right? So when we activate the parasympathetic nervous system, we have all of these bodily sensations of relaxation and calming down, and our prefrontal cortex comes back online. so we can pay more attention to what's happening in the room, the subtle cues that might be happening, that might be going on, the way people are engaging with us. We also have the opportunity to be mirrors for other people in the room. And by that, I mean, we can lower our voice, slow down our pace, provide a more open and non-threatening posture to the people in the room, and then they end up mirroring us with a calmer tone, a slower pace, having more eye contact, building trust, so that these communications, which start out and can be very, very challenging, often end up an opportunity to build a trust and a better relationship moving forward. So we're just going to keep breathing right through these challenging conversations. And it's another reason for maintaining that hand on the belly to remind yourself, just breathe and breathe. Can't emphasize this enough. I've probably said it 400 times. Practice, practice, practice. If you get a minute between phone calls or between meetings, put your feet on the ground, close your eyes, put your hand on your belly, and breathe in like you're blowing up a balloon on the inhale, and your belly falls back to the spine on the exhale. So the practice part is key. I'll try not to say that more than 10 times.
But I think why it's so important is because we're creating muscle memory. And like we mentioned, that autonomic nervous system kicks in without you really knowing that it's happening. And by practicing, this idea that you could walk into a stressful situation and just put your hand on your belly and all of a sudden your body knows what to do is a really powerful thing. But it only works if you do it more often than just when you're in those stressful situations.
Yeah, and thanks for reminding me about the muscle memory, Jen, because we're also building the memory of what our body feels like in relaxation, right? The more we practice, the more we can recognize when our body is starting to get activated and the sympathetic nervous system is starting to kick in. So it gives us an opportunity then to step back and use some of these techniques. So now we're going to move into a separate part of today's talk where we give some techniques around and discussion about therapeutic communication and what it looks like. So all of these tenets go into effective medical communication. Oftentimes when we think about medical communication, we think of it as one-sided, right? The information that medical professionals are giving to patients and or family members. When in fact, effective medical communication is a give and take and starts from a place of trust. So we want to be able to hear from our patients and family members what it is that they're understanding, their perception of the situation. So we want to be able to really be present and to be able to listen. And when the people in the room know that we're listening to them, what we're doing is helping to build that trusting relationship that can grow through time and make all medical communication just that much more, that much easier.
And communication is a skill. So of course, there are some people that maybe start out a little better than others, but it's something that we can all practice at and get better at it. And there's a number of components when we think about communication. Those nonverbal components, oftentimes 55% of communication is seen as nonverbal. This has become increasingly difficult as the world is wearing masks. We can't see facial expressions or those nonverbal expressions. And so oftentimes we have to be more expressive with our eyes or our gestures to make sure that our nonverbal communication is conveying as well as it has in the past. Tone is really important. And then what we're actually saying only accounts for 10% of communication. And so I think it's important when you think about communicating that it's not only the words coming out of your mouth, but how you're saying it, the space within which you're saying it, and what your body language is conveying. We're going to go through 4 communication skills next. This idea of being present, demonstrating empathy, nonverbal cues, and active listening, which are all important pieces of the communication that can help patients hear and receive and be a part of communication that's happening with them.
We're going to start with being present, right? Therapeutic presence, it's hard to calibrate, but it starts with noticing what's going on in the room with yourself, as well as with the other people in the room. And so you can see how the breath work that we started with can help us to have a more present, open attitude in conversation with other people. Because if our mind is calm and we're able to be more centered, we are going to be paying attention to those nuances, the nonverbal cues that are going on in the room. One of the ways that I think it's easiest to recognize how to be present are examples of non-presence. These happen all the time, right? I don't know about you, but this is pretty much my day, every day. So, and I want to normalize the fact, right, that we live and work in very high pressured situations all the time. And so we're going to experience moments, many moments of not being present. But it's important to take a minute before we start conversations to take a breath, maybe push your feet into the floor, and become fully present so that when you step into the room, whether you're stepping into a patient room, whether you're stepping into your child's room to say goodnight at the end of the day, all of you is focused on the task at hand and building a relationship that starts with trust and caring.
So demonstrating empathy is also an important piece of this communication. I like this idea of starting with a beginner's mind. And a beginner's mind is just someone who doesn't know all the answers. I think it's easy to get into a pattern when we're working with patients to think, I've seen this before, or I know the next step. And oftentimes that doesn't really allow us to meet the patient where they are. And so starting with a beginner's mind of just being curious and asking questions and trying to hold our assumptions can be a really important piece in demonstrating empathy and also making sure that our patients are feeling heard, which makes these challenging conversations a little less challenging when everyone knows that they are going to have their voices heard in them. And then another way to show empathy is just repeating your understanding of the patient's concern. And we can only do this if we've asked them. And so asking these questions and then repeating it back to them will be an important indication that not only have we understood them, but we're taking in that information and recalibrating our approach based on that. There's also nonverbal cues to show empathy. The power of a pause is such a powerful tool to use. I think in healthcare, we're so used to always having the answer or fixing something that we rush in to do that. And so this idea of pausing before we respond or pausing before we walk into a room, just to recenter ourselves or take a moment to collect our thoughts can be really powerful in helping calm our body. Cheryl talked earlier just about how we can get patients to mirror us either by slowing down or lowering our tone. And the pause really gives us the space to do that in, and it gives everyone's brain time to catch up with what's happening in the room. Physical touch can also be an important piece. And this is nuanced, right? Because we don't always know people's trauma histories. We don't always know how they feel about how comfortable they will feel with touch. But this idea of possibly putting a hand on a shoulder or putting a hand on a hand if the moment feels right can be really important, and really gauging from someone's reaction if that is a helpful approach or not helpful approach, and logging it for future interactions with them. And then simply taking a seat. Cheryl mentioned this idea of kind of being so busy. I think sometimes we stand at the door with our hand on the handle, especially for those really difficult patients. You know, the ones where they're like, oh, Mrs. Smith is here again. And so you've got like a foot in the door, a foot outside of the door, and you're like, hey, how's it going today? Good, good. But that sends a message. And so this idea of just taking a seat oftentimes can make an interaction happen more quickly than we expect, because it's allowing us to be fully present, and that sends a message that can be really important. And then like Cheryl said, keep breathing. And so maybe as you're finding yourself in a difficult situation, you may take that pause to take a breath, or take that pause to put your hand on your belly, and really using your breath throughout the entire conversation. I notice sometimes when I'm really stressed, I'll be holding my breath, and that holding of my breath gets my shoulders up here and all my muscles tight. And just like we can mirror patients to relax, we can mirror them to get stressed. And so really using my breath to just calm myself down in these difficult situations.
Active listening is one of the other tenets of effective medical communication. So in active listening, we're letting the patient know that we've heard them, like Jen said, right? So being heard can actually take emotion out of a really challenging situation. So, and we can demonstrate that we're listening actively by some of those nonverbal cues that Jen mentioned, right? Nodding our heads. It can be about, just as Jen said earlier, repeating back what someone has said. And I also want to emphasize that power of the pause, right? Because in the pause, in the silence, we can oftentimes acknowledge emotion that is going on, that sometimes we actually would prefer to just talk right over, because it's hard to sit in the middle of someone else's misery or sadness. But sitting in a pause, acknowledging that someone is experiencing tough emotions, can actually help to take some of the challenge out of the conversation, and you actually respond as a fellow human, as well as being a clinician. And keep breathing. So we're going to switch into some skills that got started out at UC San Francisco with this Impact ICU program. And Impact ICU is integrating multidisciplinary palliative care into the ICU setting. And it started out as a training program for ICU nurses to teach them communication skills, recognizing that nurses are oftentimes, at least in the inpatient setting, kind of the forefront, right, of the medical team. And ICU nurses oftentimes feel ill-equipped to have conversations with patients and families, and often sometimes with the clinicians that round on ICU patients. So Impact ICU, you can find this in Vital Talk. At the end in our references, vitaltalk.org does an Impact ICU course, and there are core communication skills, and we're going to talk a little bit about each of these core communication skills that they teach throughout the country now in hospital settings. You'll find Impact ICU classes going on. The first skill is open-ended questions. So these are exactly what it sounds like. These are questions that don't have a yes or no answer. And with open-ended questions, we just tend to get a lot more information from folks in terms of what their understanding is of what's going on, in terms of what it is that they're hoping to see happen. And by gaining this understanding of where our patients and family members are coming from, we actually have an opportunity to either reframe, reset expectations. We can redirect people, because people might think that kidney failure because of chemotherapy cannot have, there is no way to fix it. But in fact, we might be able to reframe for them and help them to understand. So, or there's countless ways that open-ended questions allow us to get the information that we need to have in order to help our patients and clients know what the situation is and to help them to move forward.
Another
then,
important.
Go ahead, Jen.
No, and then listen, that was important. And then I talked right over you instead of listening to what you were saying. Good reminder. And other things that reflections are also really important. So these can be anything you notice about the person's affect or the situation that you know may have happened earlier in the week. So this, these can start with, it sounds like you've had a really tough talk with the doctor, or it seems like you got more information than you were expecting. Oftentimes when I'm thinking about reflecting, I'm really paying attention to a patient's body language. So I may go in and say, hey, how's it going? And they say, fine, or everything's good. And I can tell, immediately with their face. And so I may say something like, looking at your face, it doesn't seem like things are fine today. Or using their body language to kind of cue them into their own emotions and let them know that you are open to having that conversation can be an important part of reflections. Another skill can be this really simple statement of, tell me more. This a little bit to me goes back to the beginner's mind, because oftentimes patients will say something and we may make an assumption about what it means. And this simple statement of tell me more really allows the patient to fully explain to us what that means for them. So there's some good examples on the screen, but also one that comes up for me a lot is that a patient may say to me, I'm afraid of dying. And I automatically am going to think, oh, they're afraid of dying because they're afraid they're going to be in pain. And so I start talking to them about how there's pain medication available. But if I say, tell me more, and then they say something like, my granddaughter is graduating from kindergarten, and it's so important for me to be there and I want to be a part of it. Well, that conversation looks really different. And so by saying a simple tell me more, it has allowed me to create a space for a deeper conversation around what's actually happening for the patient in that moment.
And these skills that Jen has talked about, I hope you can hear what kind of an excellent clinician she is in how she's helping that patient know that he or she is being seen by her. And that not only is Jen seeing what's going on, but she's able to reflect back to the patient to help the patient to feel more comfortable and to be able to speak from that place. So nurse is another one of the skills that's taught in Impact ICU. It's an acronym for right what it says on the screen, naming what's going on in the room. You can either name what it says on the screen, like it feels like no one's really listening to you. Sometimes I will name an emotion, right? So it seems like you're really angry about this right now. And then demonstrating that you understand by simply saying, I know that this can be really hard. What you're going through right now is really tough. And we just really want to know how we can help you move forward. Respecting, by letting somebody know that they're going through something really hard right now. This is really tough and they're doing a great job. Letting the people in the room know we're here to support you. It's really powerful when a patient is told by a clinician, I'm here for you. How can I help you to move forward? So just remembering this NURSE acronym of naming what you're seeing, expressing some understanding, respecting the person sitting across from you, offering support, and exploring what's going on. And then the next one is one of my favorites. It's called Ask, Tell, Ask. And Ask, Tell, Ask can be useful in all kinds of situations. I have found it particularly useful in family meetings where there is a patient or a family member, a medical doctor or a nurse practitioner, and myself. Because what happens in these meetings often is very, very fast paced, right? Medical settings, generally speaking, are fast paced settings. And as Jen said earlier, we all have learned this language that we shoot back and forth to each other all the time, right? Metastatic disease, stage 4, treatable, curable, end of life, palliative care. We say these terms that for lay people, the people that we're talking to, oftentimes are just a blur of words. So Ask Tell Ask can be incredibly effective in a meeting where you're taking a look, noticing what's going on in the patient and or family member spaces, and you can just slow things down by using this as an interrupter. So, and to that, I would say, so Dr. Jones, am I hearing you correctly that what's actually going on here with Mr. Smith is that the chemo right now has stopped working? Because my understanding is that he's had 4 rounds of chemo and we were planning to do another round. Is that the case or is something else going on? So when I do an Ask Tell Ask like that, what I'm doing is I'm playing the man on the street for the patient and or family member, but I'm also cueing the doctor, let's back this up a little bit and say this in a way that everybody in the room can understand it. So, because I'm a layperson, right? So, and doctors will take a look at me and say exactly what they need to say to a layperson, but it's also going to help everybody else in the room to understand what's going on. So Ask Tell Ask can be very useful for patient and client information too. You can ask them a question. So are you able to understand what's happening with your father's care right now? Because it seems like the doctors want to continue with treatment, but your father's saying that he's really tired. And then you can follow up with another question. Is that your understanding? Or what is your understanding? So this is just a powerful tool to use, and it's easy to remember. Ask, tell, ask.
Another important tool, especially when we're dealing with folks who are getting bad news or in end of life situations, are these hope worry statements. They're actually pertinent, throughout the trajectory of an illness, even into survivorship. Now that I say that, but this idea of being able to use hope and worry to convey information. So I hope there are more treatment options, but I worry about your quality of life if things continue the way they are going. Or when a patient expresses hope that maybe it seems inaccurate, but you want to join with them, but also convey important information. I hope you're right and this treatment will turn things around, but I worry about you spending more time in the hospital than you want to. So this idea of being able to bring together 2 really important ideas and hold hope and worry at the same time can be important to convey information that sometimes is difficult to hear. I also sometimes use the I wish statement. I wish things were different, or I wish I wish we had gotten different news today, and then kind of reiterating information, because I think both of these can soften information in a way that allows someone to hear it, but doesn't always make their defenses go up and make things difficult to hear.
And as you said, Jen, you're joining, right? So you're joining with the patient in what they're hoping for, but then you're using the knowledge that you may have and understand a little bit differently to help them to see beyond their own hope. So, but it's the joining, I think, that's really important to think about.
We also wanted to talk a little bit today about anger, because anger is one of those really difficult emotions that comes into the room. Oftentimes we may understand why a patient is angry, but it can make us feel uncomfortable. Or also, if we're not careful, we can escalate the situation. And so we want to make sure that we're listening to words spoken in anger. And again, come back to that idea of the pause or the breath, because oftentimes when people are angry, things start to speed up. And just like Cheryl talked about the mirror, I want to bring up the mirror again, because the patient gets angry and then we join in that. And so if instead of joining in that, we can use our breath to calm ourselves, it may have that same impact on the patient. We also want to make sure that we're giving them more personal space. So we don't want to be as close to them. Maybe we scoot back in our chair a little bit, or we lean back if that's not possible. Moving towards a 90-degree angle, so not sitting at such a confrontational space, but maybe sitting more next to them or moving into that space can be helpful. I may sometimes put my palms up on my lap so that I have a more open posture in myself. Breathing, of course, being calm, and this idea of showing empathy and not minimizing the situation. And so oftentimes if someone gets angry, maybe we want to be defensive or say, I didn't tell you that, or you misunderstood what I said. And that's another way of escalating. So really just creating that space in that room. You know, the saying blow off steam is there for a reason, because steam eventually will run out. And so giving someone space to let some of that steam run out. Of course, if you're in a safe situation, you know, if you're not safe, that changes everything and you remove yourself. But if it really is an anger response, giving some opportunity for that anger to run itself out can be important before you start to speak. The other thing to keep in mind is that the function of listening really is to understand what a person is saying. Just because you're listening to someone does not mean that you agree with them. And oftentimes we get caught up in this. If we are listening and not arguing or defending or responding, then we're worried that someone's going to think we agree. And it doesn't mean that at all. Really, it's just a place to create some space, because this idea of the steam running out, a lot of times people can work themselves into not being angry after they've had a chance to like process and get the words out of themselves and into the open space. Okay, so we have given you all what I hope is some new information, and we wanted to end today with a meditation, because this meditation has some beautiful words in it that we think that you could take with you. And so if your inclination is to hop on your email while I do this or start multitasking in another way, I'm just going to beg you to take care of yourself for a minute and join me. And again, this idea of finding a comfortable seat, maybe lowering or closing your eyes. Maybe you even want to put your hand on your belly like you've been practicing today, and listen to the words that I'm going to say. The meditation, or the piece that I'm using, is called Compassion with Equanimity. And it's a piece by Kristen Neff, who's really one of my favorite people in the meditation space. And we're going to use this out of meditation today, but know that the words we're using are things that you can use in the room with a patient. So I want you to imagine yourself in a caregiving context. Maybe you're caring for a patient or an elderly parent, feeling your breath, slowing things down as you pull up this real caregiving situation. And I want you first to allow yourself to get in touch with some of the stress and difficulty of being a caregiver. It's hard. Oftentimes we feel overwhelmed or tired. And I want you to really allow yourself to feel all of your feelings, even if they think you're ones that you shouldn't have, like anger or frustration. Just letting everything arise. So I'm going to say some words of equanimity to remind us that although we may seem superhuman, we all have our limitations. And I hope that you'll let these words just drop into your awareness. Everyone is on their own life journey. I'm not the cause of this person's suffering, nor is it completely within my power to make it go away, even though I wish I could. Moments like these are difficult to bear, and yet I'll try to help if I can. Just letting those words settle into you. And I want you to start to notice your breathing, particularly your in-breath. Noticing how that breath nourishes you, gives your body the oxygen that it needs. As you breathe in, imagine that you're breathing in compassion for yourself. You might even imagine a white or golden healing light filling your body with each in-breath. And as you breathe in, breathing in care and concern for your own struggle and difficulty as a caregiver. Giving yourself exactly what you need. Maybe that's strength, courage, peace, or simply compassion. Breathe in for yourself. Now I want you to shift your focus to the person you're caring for, the person who's suffering in some way. Call the image of this person to mind and what they're going through. Now I want you to focus on the out breath. And as you breathe out, imagine you're breathing out compassion for the other. Their suffering and difficulty. You might even imagine that as you breathe out, you're filling their body with golden healing light. Using the breath to metaphorically send your well wishes so that they have what they need. Acceptance, peace, kindness. And then we're going to bring these pieces together so that as you breathe in for yourself. And as you breathe out for the other. So in for me, out for you. One for me, one for you. And maybe you need to adjust the ratio a little bit. Maybe your stress or your fatigue is really high right now. And so you're breathing in for yourself, 4 for me, 1 for you. Or 10 for me, 1 for you. Or maybe you're in a good space today and the person you're caring for has needs that feel really big. And so maybe you're breathing out more for them, but always making sure that you're including both yourself and the other person in your breathing, in your circle of compassion. Remembering really that our compassion is unlimited. There's more than enough for you and the person you're caring for. And one more time, just remembering these words of wisdom. Everyone's on their own life journey. I am not the cause of this person's suffering, nor is it completely within my power to make it go away, even though I wish I could. Moments like these are difficult to bear, and yet I will try to help if I can. So bringing us back in the room, rushing through that just a little bit, but this idea of using our breath, breathing in for ourselves and out for patients is another way that you can take the breath with you and really use it as a tool when you find yourself in difficult situations.
That was really beautiful, Jen. Thanks. We're going to pull it all together here at the end with this acronym for CALM. It's all there. Center and breathe. Acknowledge that this is hard for everyone involved. Let go of any preconceived notions that you might have about what you're walking into, and then mindfully engage with the patient and our family. And we want to thank you very much for taking part today. As you might tell, Jen and I are thrilled to be able to spend this time with you. And we're going to ask that you fill out the webinar evaluation The link is in the chat. Thank you very much for putting it in there, Ruta and Sylvia. And
Thank you very much, ladies. Oh, that was so beautiful. Much, much appreciated. Thank you. And thank you, everybody, for coming.
Have a great day.